This is the little male ornate box turtle that I picked up a couple of days ago, who has a respiratory issue, and he was picked up off the side of a highway just outside of town by someone who took him home to make him a pet, and then it was about 2 or 3 weeks later that he developed respiratory symptoms. He's been a little sick for a couple of weeks, according to the timeline that I got. That's typical for box turtles when you take them out of the wild. Reptiles in general have a reputation for getting sick when you move them. They undergo even the slightest of environmental changes, especially turtles and tortoises. They're really prone to getting respiratory issues, and those tend to present first in the eyes. And a lot of people will be fooled. Even veterinarians who aren't well versed in reptiles will have the impression that the reptile has an eye infection, and normally that's not the case. And these ornates, for some reason, tend to be particularly prone to getting sick. They're for living in these more harsh, arid environments here, like Texas and Oklahoma, West Texas and whatnot. They're pretty hardy out in the wild, but once taken into captivity, they have a reputation for getting sick. And I see this all the time, even more so than when people take the eastern or three-toed box turtles into captivity. I see a lot more of the ornate box turtles getting sick. What I'm doing for him now is he's going to get an injection of Baytril antibiotic. I already started him on Baytril when he first came in, but he's going to get his Baytril shot today and a shot of dexamethasone, which is anti-inflammatory. It's a steroid anti-inflammatory. And what I'm going to do here is just going to swab him down where we're going to be giving the injection. Swab the area in his shoulder here with some chlorhexidine, and then over here, I'm gonna alternate. I'm gonna give the Dex on one side and the Baytril on the other. And once you've begun giving turtle shots, especially intramuscular, they pick up real quick. Like the first time will usually go pretty good, but then subsequent shots, they know the deal, and they don't like it, and they're ready for it, and so a lot of times they'll fight with you or even bite. And especially with the Baytril too, even though I do dilute it 50% with normal saline or sterile water for injection, it does still sting, and the Baytril injection is not comparable. You never want to use that to full strength. It really hurts, and also repeated injections like that can cause joint tissue damage and abscesses. I try to keep the actual Baytril injections to a minimum, and then when I do give them, I always make sure that it's been diluted. And so I'll go ahead and give him the Baytril first, and it really helps to have an assistant for this. Most of the time it's just me, and then so I have to fight with the patient, stabilize the patient, and hold the patient, and administer. And so where you're looking to go with this is right in the shoulder, and you kind of need to, until you get familiar with it, palpate so that you know where the muscle is. Okay. Guess that was a little off camera. I don't know, see, he doesn't like that too much. now we need to figure his dose for the dexamethasone. And he's a little lighter than I would like, and of course that's because he's been in captivity and he's been sick. He's about 188 grams. For simplicity's sake, I'm going to go ahead and round that. I'll round up or down within reason, and in this case I'm just going to go ahead and it'll make the math a whole lot easier if I round that up to 200 grams, which isn't going to make a significant difference for this drug. What we need to do is 200 grams, that's 0.2 kilograms, dose times weight. The dose here of this dexamethasone, the max dose is 0.25 milligrams per kilogram. So times his weight, which is 0.2 kilograms, and then divided by the concentration of the medicine, which is in this case 4 milligrams per milliliter, and what we get is 0.0125 milliliter. So that's just a little over what we would call 1 unit, and that's a very, very small measure. So what I'm going to end up doing is drawing up more than that into the syringe and then diluting it down so that we have a workable measure there. And I'm going to go ahead and give him, to start with, I can give him a little more than that. I'm just going to work the math out here, and I don't know if you can hear, but he's making all that noise there. He's got pneumonia. He's definitely got fluid in his lungs. So I'm going to go ahead and draw up about 3 days worth of the medicine here, which is going to be about 0.0375 milliliter, and I'm just going to call that 4 units, so that the markings on the syringe are going to be easier to see. I'm going to add to that 4 units of dexamethasone. Going to add add 5 times the amount in saline. And that works out to 0.2 milliliter. Easier to get him like this. There we go. All done for now.